Hi. The case study I chose today for my ethical stance is One Small Cut That Kills. And for those of you that didn't read that case study, I'll go ahead and summarize it. It's about a PCP working in an urban area in a large nonprofit clinic that sees multiple patients a day for a variety of conditions, ailments, and injuries. One day a patient comes in complaining of right ankle pain. He's a farmer that was working in his chicken coop when he fell down. On physical examination, the right ankle is swollen and there are a few cuts and bruises on both of his legs. The PCP instructs the patient to purchase an air cast at a local pharmacy, take some ibuprofen, rest, and then sends the patient home. 3 days later, the patient is admitted to the ER with low blood pressure, fever, agitation, irregular heartbeat, and extreme shaking. A cut that has infected his left leg is found. The patient condition worsens and he goes into septic shock. After 2 days in the ICU, he dies of organ failure. The patient's family is confused and looking for answers. The hospital pressures the PCP to apologize in hopes to avoid legal trouble. But the PCP is afraid to do so because if she admits fault, she's worried about getting in bigger trouble both legally and professionally. She's concerned what her colleagues and patients would think if she admits this error. My stance on the issue is that the PCP should show remorse and apologize to the family. While I don't think it's necessary for her to take full blame for the situation, as small cuts and bruises happen all the time that don't lead to septic shock and death, she could admit that there were some precautions that could have been taken to avoid this scenario. Some of the ethical stances that I considered that came into play for this were justice and fairness. Justice means making sure every person gets the care they deserve. It is a standard of rightness. And fairness, which is often interchangeable with justice, is a way to judge equality without letting personal feelings or interests get in the way. In this case, even though it was unintentional, the patient did not get the care they deserved. The standard of rightness in this case would be to address this issue to the family. The PCP should put aside personal fears and show justice by explaining what could have been done better. The next principle is virtue. Virtue is an ethic that guides how we act as individuals and helps us to find our moral code. Virtue helps us respect human dignity and moral rights of all. In this case, for this patient, virtue would be the right thing to do based on the moral code of the patient would be to share honestly with the family. This shows respect and dignity for the patient. The last ethical principle I considered is the utilitarian approach, which is to do the most good and the least amount of harm. It's a balance of the greatest good over harm. And although there is some risk in this scenario by telling the family member what could have been done better, I believe that the balance of good outweighs that risk. Honesty and transparency produces the greatest good. What are some of the risks and benefits of admitting fault? It's natural human instinct to fear admitting one's faults and the consequences of that, but to err is human, and acknowledging that error can help the PCP become a better provider in the future. I don't think it's legally necessary for the provider to admit fault, but I believe it is ethically the right thing to do. Not to take blame completely, but to admit that better precautions could have been taken. It's shown that the two biggest reasons patients or patients' families sue is because they feel that they have been wronged or disgraced and that they are looking for more answers. So by this PCP explaining what could have been done better might help potentially reduce liability in the future. An open, honest conversation. In conclusion, what the PCP could have done differently is better examine the cuts, possibly recommend some topical ointment, antibiotic ointment for the cuts, and spend some time educating the patient on the need to clean the cuts as well as monitor for signs of infections. And the provider could have also checked the patient's vaccine records. It's not always a clear decision what to do, but I believe in this situation, honesty is the best way. Thank you.